Hello, good day everyone. Welcome to my teaching demonstration. The teaching strategy that you will see in this video are audiovisual aids and question and answer techniques. So let us begin. Welcome our new nurses. I welcome you in our institution. My name is Leilani Abdullah Bae, your training officer for today. So as a part of your in-service education, we are going to talk about patient care and safety. So for today, we have three objectives. We will talk about the patient's rights, what are some of our hospital policies and procedures, because somebody will talk about it thoroughly. Then what are the different types of hospital codes. So guys, please listen carefully, because at the end of this discussion, I have prepared questions for you to answer. This is for me to evaluate if you really understood our topic. So first, we will talk about patient's rights. So what are our patient's rights? Number one, right to appropriate medical care and human treatment, which means all of our patients, regardless of their age, sex, race, or religion, has the right to receive fair and equal treatment. So we must not discriminate any patient. Next is right to informed consent. So if the patient will undergo certain medical procedure or diagnostic test, the patient must know what are this procedure, what are the benefits, what are the risks. So our medical doctors, they have the responsibility to explain it to the patient and secure the consent. And as a nurse, we have the responsibility also to witness the consent. Next is right to privacy and confidentiality. So all the information that we gathered from our patient should be kept confidential. That is the patient's right. We don't need to gossip about it during our breaks or outside the hospital. No. Next is right to information. So our patients, like what I've said, has the right to be informed on what kind of treatment, what is his or her condition, or what medication she is receiving. So if the patient will ask what kind of medication is this, what is this for, what are the side effects, guys, that is the patient's right to know, because she or he has the right for information. Next, the right to choose healthcare provider and facility. Our patients have the right to choose who will treat them and where he or she should be treated. So we cannot force the patient to come to our hospital because we have good doctors, we have kind nurses. If the patient does not want to come here, then let the patient go to wherever he wants. Next, right to self-determination. So our patient with sound mind and of legal age has the right to receive any treatment that he or she chose. And for those patients who are receiving end-of-life care, they have the right to write advance directives for their treatment. So number 7, right to religious belief. So all of our patients, regardless of their religion, we should respect the religious belief of our patients. Common example, patient Jehovah's Witness with low hemoglobin. So blood transfusion is not allowed for them. As a nurse, we cannot force them to receive the blood transfusion if it is against their religion. Next is right to medical records. So this one, our patient has the right to their medical records. He or she can ask sample in the medical records department. We can let her read her chart, but only the patient. For those people, relatives working in the healthcare, for example, the patient has a nurse, doctor, medical representative, relative, they are not allowed to open the chart. Then, number 9, right to leave. Of course, if the patient don't want to receive any treatment, the patient has the right to refuse. The patient has the right to go home. So, we as nurses, our responsibility here is to let the patient sign the DAMA form, or the discharge against medical advice form. Number 10, right to refuse participation in medical research. So there will be instances that our facility will hold medical researches. If the patient does not want to participate, he or she has the right to refuse. Next, we will go through our hospital policies and procedures. So, confidentiality. All staff must maintain the confidentiality of all patient medical records and information. Any breach of patient confidentiality will result in termination. So, of course, all the data gathered from our patients should be kept confidential. Just like what I said earlier, we are not allowed to gossip about the patient's condition during our break or when we are outside of work. Even taking pictures of the patient's file, it's not allowed. So, next, dress code. So, since we are here working in the Middle East, we are not allowed to wear see-through and tight skin clothes or those with slits. We are also banned from wearing outfits emblazoned with images, inscriptions, or emblems violating Islam. Directives have been made to primary healthcare managers and department heads at hospitals to ensure female and male worker compliance with the dressing regulation and exclude the violators. Healthcare workers are required to sign a related formal notice for compliance. Of course, guys, if you are going to a new country, new place, you must know first the culture and tradition of that country. And you must follow. Next, identification. To create a safe environment for our patients, all staff must wear ID badges. ID badges must be worn whenever you are in the hospital and working in the clinical setting. So our name tags, our IDs should be worn at all time in our clinical settings. This is for our proper identification and of course for the patient to trust us, because in the identification card, you will see if you are a nurse, a doctor, or a medical technology. Next, communication channel. Each department or area has developed channels of communication that allow staff to access and exchange essential information. The information outlined below is designed to facilitate communication of key information for your assignment at the facility. So, there is a channel of communication in each unit. For example, if any problem will arise, the staff nurse will inform first the charge nurse. Then after that, if the head nurse is present during weekdays or the morning shift, head nurse and the supervisor. So in case night shift or weekends, the staff nurse will inform the charge nurse, then the supervisor. So we must follow a channel of communication for to prevent chaos in the unit. So we will talk about hospital codes. These hospital codes are emergency codes formulated to alert staff and not cause panic and chaos in the hospital. So, for example, if there is fire, we will shout code red, not fire, so that the patients, the sitters, and the visitors will not panic. So, what are the different types of codes? We will discuss it one by one. First, the code red. What is code red? This is used during fire or internal emergency disaster. So when there is a fire, we will call code red. Next is code yellow. Code yellow is an external emergency or disaster. This is the code when there is a massive casualty. Code black. Code black is used if there is a bomb threat in the hospital. Code gray for severe weather like thunderstorms or heavy wind. Code orange for hazardous material or spill. Then next, code brown for utility failure. For example, there is power outage in the hospital, we will announce code brown. Code silver for active shooter with weapon or hostage. Then code pink if there is a child or infant abduction. This is admitted patients or in the ER patients that was abducted. Code pink. So code white, we are calling code white if there are combative person or aggressive patient, sitter, or visitor. Code blue for the cardiopulmonary arrest. So here are the questions that I prepared. I will give you minutes to answer. Next. So, guys, that is my teaching demonstration. Thank you for participating in my teaching demonstration.